I'm Dwayne Grice, and I'm here today with Steve Pennington. And Steve is the CEO of East Georgia Regional Medical Center. And we just want to have a little conversation for the community to kind of update on what's going on now with COVID in the hospital. There's a lot of confusion in the marketplace right now. And Steve, I know you are extraordinarily busy, and I really appreciate it. I know our followers will. You taking the time to kind of sit down with us, and well, I guess we're standing now for socially distancing purposes, but and talking through kind of what you are experiencing in the hospital and how the things our community can do to help. I'd like to kind of start by just explaining your preparation into this. We're 4 months into this. I know we're exhausted. The community's exhausted. You guys are exhausted. But tell us kind of how you prepared and how you are continuing to adapt and adjust.
Thank you, Dwayne, first of all, for chatting with me for a few minutes, and what you're doing to get the message out to the community and keeping us informed is very much appreciated and very important for our long-term community success. In terms of preparation, everybody knows we prepare for busy flu seasons at times when sometimes the vaccine works better than others. We prepare for hurricanes, things like that. But this one's a little different, especially because there's a lot of unknowns. And as you and I talked earlier, we're still trying to predict the future is very difficult and challenging for us. And the amount of time that this has been going on, we really got started changing our protocols here at the hospital in March for the pandemic. We're sitting here in July. So really an endurance test for our employees is what we're trying to do, is keep them encouraged and motivated. That's probably the biggest challenge, we see coming on, because we'd all like to kind of move on, probably like everybody would, but this virus seems that it's going to be here a while. So that's a challenge for us. And then in terms of preparation, well, we're good on PPE, made some changes there. We are able to predict more going forward. And we're having to balance taking care of COVID positive patients and non-COVID positive patients, because we don't want patients to put off care if they're having stroke-like symptoms or chest pain. We want them to get timely care in those areas. So we want everybody to know that we have taken precautions to take care of both non-COVID and COVID patients. And if you're sick, don't stay away from the hospital or your physician's office in terms of receiving care if you're really sick. But we also want to encourage everybody to take this thing very serious. We are taking care of COVID positive patients here at the hospital. And for example, right now, I think we have 5 COVID patients on the ventilator. So what we're trying to also get the message out for our community is, if you're a vulnerable population in terms of health risk, or if you're elderly, you got to take it very seriously, because we see a lot of those patients here in the hospital, and it's very unpredictable, but some of them will get very sick quickly. So we need to take care of ourselves and be aware and make sure that if you're in one of those conditions, that you plan ahead accordingly as much as possible.
Well, and that's where a lot of debate in the community on the mask, well, statewide, nationwide, about wear a mask versus not wear a mask. We're seeing crowds, it's very important that the community wear masks. And people show studies how masks aren't effective or this or that. Tell us your professional opinion on masks, and how does that help you in the hospital?
Well, here at the hospital, we want everybody in masks. I'd like to see masks and everybody in the community too. We follow the CDC guidelines and the Department of Public Health guidelines, and they recommend that. And so that's what we're doing here at the hospital. We try to mitigate as much risk as possible for our employees and for our patients. And I don't think we can necessarily eliminate it, but we are doing everything we can. And mask is one of the most simple things we can do to try to protect ourselves and others from getting the virus.
There was concern early on about the virus. We shut the whole economy down, and part of the reasons for that was we're hearing words like flatten the curve, we're hearing words like surge capacity, PPE devices, those type things. And so why is this different now? So when we shut down, we only had 40, 50 cases total in Bullitt County. Now we're averaging about 100 cases per week. You had stopped elective surgeries at that point. Now you're continuing elective surgeries. I know that's important. It's important for you as a hospital, and it's important for us as a community. But there's some confusion in the community about what's different now.
Well, I think the main difference is since around July 4th is we've seen more cases. That's the main difference. We've been taking care of COVID positive patients since March, but over the last 2 to 3 weeks, we've seen a large increase in the number of patients needing admission to the hospital. So I think that's why we gotta follow the CDC guidelines like we discussed earlier, and for the patients again they're at risk, and also elderly patients need to take even more precautions to protect themselves.
But right now, you feel comfortable where you're at with PPE and those type things. It was a concern before.
Yes, there's a lot of, not many of us have been through a pandemic, I don't think so. There's a lot of unknowns. So we were concerned about not having enough PPE, but I think we remedied that one. We're constantly watching it. Every now and then something will get on back order and we have to make, accommodations, but our PPE is strong right now. And we anticipate that being the case going forward, but at the same token, we don't let our guard down at this point.
So in our daily reports from you, we are reporting every day the number of COVID patients in the hospital, and it fluctuates. Recently, it's been between 18 and 24, and the number of people on vents. We were 5 to 8 on vents. You feel comfortable with the capacity, and I know that's a tough question because none of us can predict what tomorrow holds. We're heading into hurricane season, and you got a lot of other things that you have to juggle as a CEO of a hospital. You have staffing issues and all this, but explain to us kind of some of the modifications you've made as you've managed this. So there's been modifications in treatment. We've gotten better, and we've learned things, right? Yes. And so our fatality rates, our death rates are lower. And hopefully we can continue that, but there's reasons for that too, right?
Right. I think we are proud of the care that we provide here at the hospital, and I'll give you one example of how a change where we make. Actually, we're in the process of making it right now, and we've designated one of our ICUs is 12 bed. We have another 12 bed unit that's non-COVID patients, and we had a step down unit. So, which means patients get in between medical surgical care and ICU. So we need more beds that are non-critical care beds for the COVID patients. So we're converting a unit today as we speak to that, which because that'll free up some of those patients don't necessarily need to be in those units. So that'll give us more critical care capacity once we make that transition. And as I told you, Dwayne, this thing, when I share information with you, I'm sharing a point in time. We're making course corrections each and every day, and that's the thing. I think that stresses everyone out too, because we're very protocol driven. We want to do the same thing each and every day in healthcare. That's how we increase the quality of care and increase safety for the patients and staff members. So having to make those modifications throughout the day and changes, that creates a little bit of stress for us because the unknown of what's coming. So that's why we're trying to keep our staff upbeat. They're doing a great job. I thank them every day, and I can't thank them enough for the job they're doing. It's just really inspiring, and then other employees are maybe not as clinical or also helping out, whether that's answering the phone, running supplies back and forth, etc. So that's what we're trying to do here at East Georgia to keep everybody positive. And I want the community to know we're here for you. If you're sick, you can count on us. In the same token, this is serious, and everybody needs to take it very serious and take extra precautions. Not just today, but for the foreseeable future. I know we can't all stay at home all day. We have to, we got to get out and do some activities, but do them cautiously. It's what I would encourage everyone to do.
So people are hearing stories, and we've seen stories on social media about some hospitals in our region actually transferring patients multiple states away. We're seeing the bed capacity issues in our entire region. So that's more challenging when a hospital, I kind of describe it sometimes in our emergency operation plans. we don't plan for everybody's main street to be on fire at the same time. So you can rely on other communities and hospitals. But right now, I guess the picture I'm trying to paint is that everybody's experiencing this. This isn't unique to us, at least in our area of the state.
Correct. I mean, in our region right now, and you know better than I do from some of the data you shared with me this morning, we are experiencing high occupancy, and ICU, capacity is a premium. That kind of ebbs and flows, so we plan accordingly and take care of those patients, as needed. Sometimes we'll have to hold some patients in the ER until we get them placed, etc. We try to limit that, but occasionally it does happen, and so we respond accordingly and work with the hospitals in the region, try as a team. And that's the other thing I would say is, we do have a good team, a good network we work with. Everybody works together to take care of patients when they need us the most.
So from a community perspective, I know that we had really cranked up on doing a lot of things like meals for your staff, notes, cards, letters, things to help show the staff how much we appreciate it. Because I know that sometimes there's a world here that you see every day that we're not seeing out in the community, and the sacrifices and the commitment that they're making. There's got to be concerns about them taking it into even their houses and their families, and so there's a level of commitment, a level of expectation that you're experiencing. So what can we do as a community to show our appreciation?
I think what has been happening is we get very nice cards, thank you notes. We have people come and use sidewalk chalk on our grounds and by the employee entrances, and thank you to the employees. And just make sure, if possible, you thank them for what they're doing. They're working very hard to be here for the community, and the families when they need us the most. So we appreciate all those meals, that they've delivered as well. But I think really the nice gestures, the cards that they send to our employees. One of the ICU nurses joked with me on one weekend, said if the community kept sending meals to the ICU, she was going to have to go on a diet, kind of jokingly. But she had a big smile on her face and was very appreciative of everyone that's showing support. And again, that's what we're here for. That's our job. But this thing has been going on so long, and we see it going on in the future. So that's kind of little things that help our employees stay motivated, and as we work through this, virus that looks like it's going to be here for a while.
People in the community now, some people seem to take it very seriously. Some people don't take it seriously at all. What's kind of your experience, or how can you speak to that?
Well, my experience, Dwayne, has been when people in the community have a close friend, a family member, a coworker that tests COVID positive, and they've been in close proximity to that individual or individuals, especially if they weren't wearing masks, then the COVID-19 virus becomes very serious to them. And it shouldn't take that. And that's why we want to encourage everyone to wear your mask, try to mitigate the spread and mitigate the risk of COVID-19, and not having someone be exposed to someone that's positive to get you to that point where you do take it serious. That's been my experience in the community, in my interactions, here at the hospital. So that would be one message I'd like that everyone to think about. Don't let it take being exposed to someone that has the virus without wearing a mask to be able to take this thing seriously.